I'm Dr. Jandio Miguel de la Cruz. I'm from LoveYourself Incorporated, and I'm currently the Chief of Medicine for LoveYourself Clinics. I'm previously the primary care physician for Victoria by LoveYourself, providing transgender health services and HIV primary care services. LoveYourself is a non-government, community-based organization that has been volunteer-driven since it started in 2011. It started venturing into transgender health in 2016 by launching the first transgender-specific community center, which is Victoria by LoveYourself. Victoria was previously known as Victoria Health and Wellness Center through the support of LoveYourself's partners, donors, and US-based nonprofit organization and Stop AIDS Now back in 2016. Then by 2018, it was officially absorbed by LoveYourself and was eventually became the Victoria by LoveYourself. So initially, it only provided HIV screening, and then eventually we ventured into HIV treatment, STI treatment as well for non-pill HIVs, and then we opened the transgender health services, providing general wellness for our transgender brothers and sisters. We also provide gender counseling as well as medical consultation for those with comorbidities through their transitioning process. There will be 3 levels of services to be made available at Victoria by LoveYourself. Currently, we are at Level 1 services, which provides HIV screening and counseling services for transgender people, basic health checkup, baseline laboratory procedures, screening and treatment for sexually transmitted infections, and referrals to specialists such as endocrinologists and gender-affirming surgeons. Bilang kauna-unahang transgender community healthcare provider sa bansa, isa sa mga strategies na ginawa ng Victoria is, una, dinevelop namin ang clinic services by having transgender staff within the clinic. So we had transgender nurse, transgender frontliner, and a transgender front desk. So aside from that, we also developed yung skills na kailangan namin para mas maging accessible kami for our transgender clients, such as yung skills that is needed. Maliban sa clinical, we also develop yung cultural skills namin. So in terms of training, counseling, even yung mga volunteers namin, we also try developing mga modules for them to be more trans-sensitive. Aside from that, with the campaigns that we launch, we also involve transgender people to be ambassadors for HIV services as well as for hormone therapy services. We also partnered with beauty queens to further promote health and wellness for women, both transgender and cisgenders. In order to make our community center more comfortable for our transgenders, brothers and sisters, we had to make our clinics trans-friendly. We also had to develop our forms that would be more trans-friendly by including their gender identity, preferred pronouns in the forms, and by addressing each client by their chosen names. Maganda rin kung ang ating mga visual presentations or ating mga posters would also involve transgender people that would provide more visibility for our clients as well. Despite these challenges, what we have gained so far, we have currently more than 1,800 transgender people in our service, either through hormone therapy, HIV interventions such as testing, and even PrEP. And even for those transgenders living with HIV, we were able to bridge them to treatment. We also started having more transgender volunteers, and by engaging more volunteers, we are able to become more transgender sensitive among the community of MSMs. By rolling out transgender sensitivity workshops and even transgender health workshops for other healthcare providers, we are also gaining more support from the medical community, such as from endocrinologists, psychiatrists, and even pediatric endocrinologists and surgeons. Dahil dito, mas napapalawak yung ating network of mga transgender healthcare providers. Not just sa amin, but even from other institutions and facilities. So aside from Victoria, meron ding iba't ibang mga facilities or hospitals na nagde-develop ng kani-kanilang mga gender diversity clinics kung tawagin. Kasama na dyan yung ating mga kapatid from the Manila Medical, the Medical City, even other big-time hospitals such as UPPGH, may kani-kanila na silang dine-develop ng mga gender diversity clinics. Kasama sa mga gender diversity clinics na to, ang iba't ibang specialties such as yung endocrinology, endocrinologists, psychiatrists, and psychologists. And then, of course, mga surgeons, not just for plastic surgeons, even mga gynecologists and urologists kasama rin dito. Despite providing free services for our transgender clients, one of the challenges that we still encounter is that transgender people still have that fear of coming to clinics or coming to our centers. That is brought about by the discrimination that they experience from a previous healthcare provider. Currently, we are also trying to reach out to other healthcare providers by providing transgender sensitivity trainings, so GSC, and even basic trans health workshops. Ang aming mga trans health services ay available sa Victoria by LoveYourself, Lily by LoveYourself, at para sa ating mga healthcare workers and providers na interesadong mag-develop ng kanilang trans health services, maaari nila kaming lapitan sa Transcend by LoveYourself. Bilang first batch ng HTTP, marami ako natutunan at nakilalang mga tao. Kaya, sali na!